Good morning. I am here. I'll start in just a minute or two. Okay. Good morning. I will go ahead and hello. How are you? And I want to go ahead and get started. I see a few of you have joined us already. Dr. Rahman may be going a little long, but obviously it's recorded. I do want to take a minute. I'm going to go ahead and start my timer. I am running my timer this morning because I will stop with about 10 to 15 minutes left of class to go back and talk to the whole class about incidence and prevalence. And I will try to clarify that because I know I had quite a few people in virtual office hours earlier this morning that were asking those questions. So I do want to make sure I have addressed those. And things along those lines. What you are seeing on the screen right now, and I'm going to go ahead and turn my camera off because you don't need me. I'm going to let you all, this is the Jordan Health Profile. I have it just in small version right now. You can't read it, but this is one of the 3 assigned reading materials that you have different pages from. I wanted, as I said, end of last class, is I wanted to take some time to kind of go back and shift gears a little bit away from the COVID discussion. We're going to take the next week or two and talk more about some other statistics and other health issues that are really important in Jordan besides COVID. Okay? So I do want to take that time. And I see somebody's telling me Dr. Iman is still in lecture. Don't worry, it's all recorded, so we are good and stuff. So don't worry about that. They have a chance to come back in, and I know I've always gone on to her time occasionally too. So it's all okay. Farah, um, I'm going to dismiss your question. Like I said, I'm going to talk about incidence and prevalence specifically in the last 10 to 15 minutes of class. Okay, so everybody knows and everybody will have plenty of time to be here by then, so nobody misses that. As I said, today we're going to start talking about some other health issues. A week or so ago, you had an assigned reading, and it was from this Jordan Health Profile, which was put together by the WHO in 2015. Yes, that is 5 years ago, but that is the most recent complete profile. They do these about every 5 years, so we should be getting one in about the end of this year, early 2021 for the current up through 2020. So this is the most current of what we have right now. Why I wanted you, so I just want you to see what the cover looks like when you open it. I am going to skip ahead, and in the contents, the 2 areas you were asked to read about, one was communicable diseases and the other was non-communicable diseases. Um, I'm going to ask you a quick question. You don't need to answer me directly, but in your heads, COVID fits under which category? Communicable or non-communicable? Okay. Hopefully in your head you immediately went communicable. Okay. There are other communicable diseases that are important that we will talk about. We already know polio was eradicated. Dr. Aman's talked about it, and I mentioned trying to find out about that. We can be talking about other things, and we'll look at those pages very quickly. But most of the time, what we really want to talk about are the non-communicable diseases. So I'm going to skip forward, and I just want to point out a few statistics that are important. When we talk about communicable diseases, notice here that they've added in the table, and I'll try to make it a little bit bigger so you can see, that they're specifically talking about HIV, tuberculosis or TB, malaria, some tropical diseases, and down here it says vaccine preventable. That would be things like diphtheria, pertussis, measles, mumps, rubella, tetanus, all the things, chicken pox, hepatitis B. These are all what we would consider communicable diseases, but we have vaccines for it. So vaccine prevents us from getting sick, which means, and we're going to start to look at a couple of new questions. Excellent. I see a couple of you did say communicable, which is exactly what you should have been saying. Guys, I can't stop. Like I said, we're recording, so please, we're okay. Everybody, if they're still in Dr. Aman's lecture, it's okay. You can catch up and come back to the recording here. Now, so as we keep talking about this, I'm going to go ahead and I have to minimize the pages back out for it to shift for my page view. And I apologize on this. So there's going to be a lot of reducing pages and making pages bigger again. What I want you to see is when we talk about, and it just briefly, if I go here, let's see, it starts off by talking about HIV and AIDS. And it gives a couple of clear bullet points at the very beginning of the readings. Obviously, when we talk about HIV and AIDS, it is a communicable disease. It is a sexually transmitted communicable disease, as well as one that is a bloodborne pathogen, which means a lot of cases actually come from sharing of needles. So IV drug use is a prominent way of also carrying it. They have really good surveillance and follow rates on TB. We're going to see TB is very small in Jordan. And malaria, we're going to find out that guess what? There are no malaria cases in Jordan that are community spread. They are all imported. Okay, so they've all people that have traveled in. So when we talk about HIV and AIDS in Jordan, everybody is blood tested, whether you realize it or not. Routine testing is administered on 100% of all blood collected. So when you go to have lab work at any time done, they actually run a basic kind of test on this. And I just want you to be aware of that they're actually watching that. Okay. If I go down, and let me see if I can make this continuous page. Let's see if I can make this scroll now. Okay. We have a hepatitis B vaccine. I thought that was important to mention. All of you probably had it in your first year. We usually give that to infants now. And tuberculosis, like I said, I'm not asking you guys to come in and memorize these numbers. But notice, less than one case per 100,000. So you would look at me and go, gosh, Dr. Heather, TB is not a real problem here. Well, we're very fortunate. It's not a real problem here. This is a disease that is also respiratory and is a droplet, much like COVID is. So it would spread very easily. For those of you that may have traveled to the United States, part of, if you are not a U.S. citizen, anybody wanting to travel to the U.S. from other countries besides Europe, So if you're traveling from anywhere in the Middle East, you have to have proof of a negative TB, of a scan that shows you do not have tuberculosis to go into the United States, because it is very easy to spread. Now, if we go forward, like I said, malaria, you'll notice that all cases were imported, and it tells you actually where they came from, such as India, Sri Lanka, Libya. Okay, so we don't have local transmission of malaria here. Now, could that change? Sure, if we have a mosquito problem, because malaria comes from a vector, and the vector is a mosquito. Okay, if I scroll on down, tropical diseases, don't worry about. But here, what we find is that, guess what? This is what I want you to know. It's not these numbers. Hear me. It's not the numbers. It's that most communicable diseases in Jordan were preventable. So if we're talking from a health policy perspective, we are talking about what? Health policy. If we can prevent most communicable diseases, it meant that the government is really, when they talk about policies, is focused more on NCDs and how we prevent those or how we treat those. It means our budget goes to that direction. We haven't, the only thing, and this is, remember when we looked at the big trends of what people were dying from globally and how it changed? Remember, the only thing we really saw was the one thing where, did I miss something? Okay. The one thing, and guys, it's okay, you came late, it's all recorded, don't panic, we're just talking about NCDs and communicable diseases from the Jordan Health Profile, and I'm just pointing out facts that what you can see here, and when we look at all these vaccines that were purported, is that most communicable diseases we give a vaccine for. A vaccine typically has been very inexpensive, okay, and we can prevent it very effectively. What most of we spend when we talk about health policy, and this gets us to this point, are non-communicable diseases. What would you like me? I'm seeing a question asking me, can I repeat? Guys, it's okay. You don't need to text me to tell me you just finished a lecture. That's not really what the Q&A is for. Okay? It's recorded. I understand she ran long. Some of you are coming late to class. It's okay. As far as that goes, you just go back and watch the beginning of the recording. Okay? Now, as I was saying, what we have done, Lean, you all know where to find the recordings. There's a channel where all the recordings are posted. Okay? Now, what we do know is that non-communicable diseases typically have been the health issues and where health policy is focused. That's in most countries, because cardiovascular disease fits in non-communicable, because cancers, because mental health. When you look at this, it talks about, if you notice down here, besides that, it talks about violence. It talks about injuries, so traffic accidents. It talks about nutrition when we talk about preventable diseases. So all of these are non-communicable. Guys, these are from as I've said, these are not slides. This is from your assigned reading that was a homework. This is from the beginning of the World Health Jordan Health Profile. Okay? So when we're looking at the reading, and this was the assigned reading that you had 2 weeks ago, I just want to kind of come in here, and it starts off with some really important bullets. Okay? I do expect you to be able to know what kind of diseases. Diabetes, is it communicable or non-communicable? Can I give it to somebody or not? If I can't give it to somebody, it's non-communicable. Okay, cardiovascular disease, I can't give it to you. It's non-communicable. Traffic accidents, non-communicable. Okay, so we're talking specifically about those things that really have to do a lot with health behaviors. Um, and they identified some key things that needed to be done in Jordan. And one was to start integrating mental health care into primary health care centers. This is an actual policy. Okay, so we go through and say we need a policy where what? We have people that can help identify mental health issues when you come to the doctor for some basic health care. They also recognize that traffic incidents and fatalities and injuries in Jordan are really, really important. So they created the Supreme Council for Traffic Safety. Now, the next two have to do with two very different conditions. Okay, one is the universal access to eye health. This has to do with diabetes. Diabetes is a continuing issue and it continues to grow, especially in the Middle East and North Africa, which is what we call the MENA region. And therefore, one of the most important things we can do is have regular eye exams to prevent and correct for blindness before it happens, because often people will go blind if diabetes is untreated. It's one of the bad side effects if diabetes goes unprevented. So they made a national plan to try to have universal access to eye health. It's much easier for me to check your eyes and to correct the vision and to make sure we get your diabetes under control than it is to have to go through tertiary prevention and have to rehabilitate after you've lost your sight completely. The other is something that probably Dr. Aman has talked about, which is the use of iodine. Iodine we put in salt, and it is a mineral, okay, and it is very important when it comes to children's health. If we don't have enough iodine in your diet, it actually can cause children to not develop mentally at a proper stage and cycle. So what it says down here is that, guess what? Jordan has been very successful in having a salt iodization program. Okay. We've already seen some of these numbers before. When we get down here, when we talk about NCDs, notice that here in Jordan, in 2015, it was 75.6%. In 2017, it was 78%. In other statistics, it's 70%, but somewhere between 70 and 80%, okay, of all deaths are related to NCDs. So before COVID came along, what did we have? Before COVID came along, we were focused on our health policies on these issues because these are the important issues. Like I said, I've spent the first 3 weeks just talking about COVID as a policy because it's interesting and it's happening now. But what we know is that historically, we need to be also recognizing that NCDs are typically the health policies you're dealing with. As doctors, let's hope by the time in 6 years, when you all become actual physicians, COVID, let's hope, is a thing of the past. We have a vaccine. It's something we live through. We talk about it and you explain how you learned about it. You explain it to your kids one day and they go, really? Wow. And you will be back to treating people with cardiovascular disease and back to treating diabetes all the time and back to dealing with road injuries. So this becomes really important. Like I said, several of you have asked again, where am I? I'm in the Jordan Health Profile, which was the assigned reading from week 2. Okay, it's not slides, it's actually from your assigned reading. And I am just wanting to touch and highlight on some of those things you were asked to read. Okay? Now, you're curious to know, oh, this is an interesting question. Guys, I don't speak Arabic. I can't read it. Okay, doctor, why you highlight some paragraphs? Because those are things I thought were important. If I go back into my published, I published one that says, I'm curious to know about the percentage of salt iodization for children for a stable mentality. I forget what the dosage is. Actually, when we get to SDGs in the last unit, which is chapter 8, I think I have the dosage they require that prevents retardation. I don't know it off the top of my head, so I apologize on not knowing the actual number. What I can tell you is about 50% of those in developing countries where they do not iodized salt, they iodize rice as well to try to make sure it gets sufficiently into the diet to help with mental retardation. Okay, great question. Now, let's see. As I keep going, so what you see down here is we see what? And again, notice it hasn't changed from the PMR you saw in my slides. Notice about just over a third are cardiovascular deaths. Again, about 15% respiratory. Then we get down here and we get diabetes. Diabetes has gone up since 2015. Okay, but what is important is, if you remember, we talked about NCDs also account for something called premature deaths. And premature deaths mean what? People die before they reach their life expectancy. What we do know, and is if you look right here, 20%, so 1 out of every 5 adults in Jordan between the ages of 30 and 70 dies from one of these 4 main non-communicable diseases. That becomes important. That's why the policies are what they are. Okay? So, what about cancer? Cancer we'll talk about as well, but it's not one of, it comes in Jordan as being high, but we look at that for different reasons. And when we look at cancers, we're going to look specifically very much at lung cancers and esophageal or stomach related colon cancers, because those are the two that are more prevalent in Jordan. Okay? The other thing I really want you to look at right now that I wanted to bring very close attention to is when we talk about children. This becomes important. Notice prevalence. So if I say the prevalence of insufficient physical activity in adolescence is 85%, and then it gives me the specifics for boys versus girls between the ages of 11 and 17. The prevalence, is that the number of new children that aren't exercising, or is that the number of existing children? What you should be saying in your head, you should be going, existing, Dr. Heather, existing, it's prevalent. It's how many children don't exercise regularly. This is a big problem. When we look at teens, 85% do not exercise, do not get enough physical activity. If as a teenager you don't get enough physical activity, what's going to happen? You're going to come up here and you're going to probably have cardiovascular disease. You may be related to respiratory diseases and lung capacity and cancers. Okay, they're all in here. So we start to see diabetes. All of them are related to not having, or what we call having, a sedentary, which means inactive lifestyle. Okay, the other thing is if we don't exercise, you will have hypertension, more so than people that do. I can very quickly, we can do a blood pressure. Okay, and a blood pressure will be lower for people that exercise regularly when they're resting than it is for others. So we see this all the time. Somebody that runs regularly will have a nice low resting blood pressure, and you go, why is that important? Well, blood pressure is measuring just this, the pressure on your arteries as blood is being sent through the system. As it goes through your system, those arteries have to stretch and give. If we put too much pressure on them, they lose elasticity, much like a rubber band. So we see that all the time. Now, I know a couple of you are asking me, do you want to download this lecture on Final Structure? Download, I don't know what you're asking. Okay. Do we have to save these numbers? Again, I am trying to make sure you understand big trends. If by now you haven't, you should recognize, oh my gosh, about a third of people in Jordan die early from heart disease. Boy, 1 in 5 people die from this. You should have seen these numbers enough that you start to get the basics. Am I asking you to know 34.6 on a given day versus 37? No. All that tells me is you can memorize. It doesn't tell me you understand what are the health problems in Jordan. Okay? Somebody says no sound, but that is their problem. Sound is coming from my side. Okay? Existing, yes. And I see this question, and I'll go ahead and publish this. And this one says, are injuries and accidents considered to be communicable or non-communicable that aren't in the percentages? And this is a tricky question. And yes, obesity is high. If we don't exercise, that's another way we control our weight. And stuff. So I have answered the questions that are there. Guys, if you're not listening to the lecture, then I'm going to stop a second because I've gotten 2 or 3 questions. Specifically, what do I need to memorize? I am not a high school teacher. I am not going to answer questions of you must memorize this and you cannot listen to me. You should be listening to my lecture, and I would say that most of you can probably tell. I'll tell you what, this is important. That's what I've been doing. That means, oh gosh, I should probably know that. Okay? Stopping the flow of the lecture, and I know you're getting used to college and university lectures, but you need to be very asking me continually, what do I need to memorize? Do I need to know this number? Do I need to know that number? If you're going to ask those questions, I will say yes to everything. Okay? I just want to be really clear. I'm trying, you need to be listening to the lecture and taking notes. Okay? I know for some of you, I go what seems a little fast because I'm talking English and not Arabic. Okay? I encourage you, all lectures are recorded. You have a channel in your team where all the lectures are housed. You can go back and listen to them again and again. You can go back and review them slower so you can make sure if you got something. Okay? So I'm going to come back again and I want to talk about this. So we look at this, children that don't exercise, we end up with hypertension. Notice down here, exactly what one of you just said when you talked about obesity. That's exactly what's in the notes. Notice it affects 30% of the population in average, more females than males. Okay? If we continue on down, smoking. Hear this. Smoking is the #1 reason for many non-communicable diseases in Jordan. This is not around the world. This is Jordan because most of the world has gone anti-smoking. Okay? You are actually going to do a survey this weekend for me. I'm going to publish a survey. I do expect, and I hope I can get at least 90% participation on a study about smoking and vaping. It is anonymous. I will not have your personal identification information, but I will share it with you and I will share the results. So we're going to look at about smoking and vaping habits among college students, and you're going to give me information. Okay, so we got a survey this weekend. We're going to look at tobacco specifically. Okay, Here's what's interesting is, why are we going to look at this? From a health policy standpoint, there is no national strategy for tobacco control. In other words, we do not have an effective health policy to control tobacco. They have raised a little bit of money of taxes on tobacco, but you know what? They didn't raise it to stop people from smoking. They raised it just enough that it cost people a little bit more, but it didn't stop them from smoking, as to get more taxes. So we have a problem. And what we do know is there is a specific goal. Remember, we talked about goals before, and objectives and targets. So if you come back here, Jordan does have a goal. It's to achieve 30% relative reduction in, again, prevalence of current tobacco smokers above the age of 15. So they want to reduce the number of current smokers by about a third. Okay? How are we going to do that if we don't raise taxes? If people here, and like I said, Jordan has the highest rate of smoking in the world. So this is an important policy we need to talk about, because it's definitely related to about 85% of all lung cancers. It's related to other kinds of cancers. It's related to hypertension. It's related to cardiovascular disease. So all these other NCDs are related to a health behavior. Just like COVID and catching it is related to a health behavior of socially distancing and not wearing a mask. Okay? But here you're not necessarily hurting other people. Although in the US, we don't let people smoke in public, because we do know that children that have parents that smoke are likely to suffer from asthma, which is secondhand smoke damage. We don't let people smoke in public buildings because of secondhand smoke damage. We don't let people smoke in restaurants or bars. Secondhand smoke damage. In other words, we stop the boundary and say, you can smoke in your house, on your property, out in public, but not in a building. And that's the rest of the world. Jordan does not have that compliance. There is a no smoking policy at Hashemite. However, you can walk into some faculty offices and there's an ashtray and people are smoking. You can walk outside of class lecture hall and I can see students smoking, even though there is no smoking in the building. So we have not effectively, again, not a good health policy. Okay? Now, I'm going to scroll on down and say that we've talked about, and here I just pointed out the Ministry of Health, with the support from the WHO, has been focusing on mental health. And this is really important because mental health in the Middle East has often been ignored. Okay? So we're trying to get better about mental health. You all asked about injuries. Notice, and you asked also, were injuries related to NCDs? The WHO says that injuries are NCDs. I agree with them. Some people tabulate them separately. Okay? You can look at a chart and some will keep it separate and some will include injuries in this. When I look at this, if you notice, 11% of deaths were caused by injuries. Of those 11%, almost two-thirds, were due to traffic injuries. So the most common type of injury death is road traffic. We're going to see this when we look at Jordan's specific, the 10 causes of death for Jordan. You will see it is in the top, it is number 4, okay? Traffic fatality, when we talk about a rate per population. Okay. Now, it says traffic fatality rate was 22.9 per 100,000. When I read that statement, you go, oh, is that accrued mortality rate? Is that case fatality? Is that cause specific? Is it PMR? Oh, my thing is telling me to start. Okay. You should be answering, oh, Dr. Heather, I know that. Okay, stop, cancel. Excellent. Okay, you should say, Dr. Heather, that rate right there is telling me it is case specific because it's using the total population of Jordan per 100,000 and it's giving me a number. Okay, these and the reason, so why we are doing these rates? So you can read and critically understand. This would be a great example. I could have a number like this and say in 2020, it was estimated this was this. What kind of rate is this? Now you see how I can ask a question on an exam. Okay? So, the prevalence of disability. Again, notice down here, what starts to be interesting is one of the leading disability in Jordan is blindness. Notice that that is why they have what? Have created the new policy about having eye exams and universal eye coverage in Jordan. Policy related to who's impacted by disease and conditions. Okay? I just wanted to bring your mind and your attention to a couple of these. And here it says it again, the 5-year plan for eye health. Okay? It goes on and it talks a little bit about nutrition and some of the problems you'll see here. Down here it talks about, oh, so it talks right here about how much is the average iodine associated with intake. So your question that you asked earlier, here's what it's measuring. So this is what they are looking for when they look at the actual limits. Like I said, I did not remember that or know that right at the time. So I just wanted to take some time to kind of stop and show you, and let me share this. Hold on, I'm sending live. So now we're coming back to me. Okay, I just wanted to take some time to go over the reading assignment. This was part of on the syllabus. This was not something extra or added. These were things I expected you had read. Okay, in reading those, it helps you understand why we do certain policies. We kind of have to have a feel for the numbers. In other words, we do need to focus on tobacco prevention. We need to focus on what kind of policies maybe we could create. And we're going to talk about different policies, whether it affects the individual. Does it affect the person? Does it affect the community? Does it affect the people that sell it? Does it affect by taxes? So we can have different types of policies that affect different levels and have an impact on who has access. Okay, I did say, and the reason why my timer was going off was because I wanted to take the last few minutes of class to go back with everybody and discuss incidence and prevalence one more time. Okay, incidence is just this. It's the number of new cases. Now here's the thing. When we do this, we have to define what is new. And a lot of you have had questions. Is this new? I counted this is new. Well, new is kind of an ambiguous term. We have to define it. So it could be new means on today. Or maybe we say the number of new cases this week. Okay? So when you do your math, you have to say it's for a week of or for the day of. That's where we need to be better at explaining what we've calculated. So a lot of you have calculated different rates, and even in my questions that I made and said try between, oh, sorry, between Monday and today, I said to try these rates. And I didn't tell you what I considered new. Okay, so that is my mistake. What I am going to do, and in talking with lots of you through office hours yesterday morning, and some of you were in office hours this morning, okay, what I am going to do is make 2 or 3 questions over the weekend that are very specific, and they give you my definition of what is new, my definition of what is at risk in the scenario, okay? And I'm going to give you 5 multiple choice answers, much like a couple of the questions did at the beginning when we looked at the mortality rates. This is the same way you will see them on exams. Obviously, it's not the same questions, but that will help you understand. Many of you are excellent at the math and excellent at the numbers, okay? So incidence is number of new cases. For some of you, you may have taken new cases when you looked at the statistics that I gave on the slides, and you may have said, oh, the number of new cases that day were 69. Well, that is that day. And that is correct if you were doing incidence for that day. I was looking at it as number of new cases over the last period of time, since COVID has come along, because COVID is a new disease. That is my mistake, like I said, in not telling you what would be new. And you go, well, why didn't you just use that day? And a couple of you asked that, and I answered that question, and I want to answer it for the rest of you. I didn't use that day because, unfortunately, at the time, I didn't know how many people were no longer, we knew how many people were no longer sick, but not on that day. So in other words, to remember, the bottom of incidence in the denominator is the people at risk, which means I have to know exactly how many people on that day had the disease, how many had gotten over it, and how many died on that specific day. If I know all of that criteria, then I can do the day. But it's very specific. Do you all remember when I asked you to calculate PMR, and we can't really calculate PMR for COVID right now because we don't know how many people have died in Jordan all total in 2020 so far. Some of you estimated, and that was great. Okay, this is the same thing. We get some statistics from the government, and they're publishing a lot of numbers that let us calculate a lot of things, but they don't quite give us everything on every day. So it makes it harder, and sometimes we estimate and sometimes we guess. I want to get you out of guessing. So like I said, I will work on a couple of questions. I will send up the announcement once I post them, and when I post it, I will post it with the questions, and I will post it with answers that follow, okay? So they'll both go up at the same time. Now, prevalence. So hopefully that explains incidence. Cumulative incidence is just how many people is the same, and actually one of your classmates brought this up, is actually the same as pure total prevalence, lifetime prevalence, okay? Cumulative incidence, we add up how many people got a disease at any time. May have gotten it this year, may have gotten it last year. How many people have had cancer over the lifetime, and then we compare that to the total population in Jordan right now. So cumulative is just everybody that ever had it. Now, when we talk about prevalence, we're talking about existing cases. So what we have to know is, again, who got better, who died, is there immunity, things along those lines. So when we do the top number, we're looking at how many people have it right now today, okay? And that is point prevalence. It's a snapshot, again, kind of like what's happening right on this very moment. How many people have actual COVID cases in Jordan today? That would be point prevalence over the total number of the population in Jordan. Period prevalence is an average. So it takes in account variation that happens over time. And we get a nice average. The same way you get an average in a class. So it stabilizes. One test you may do better on, one test you may do worse on, but your average kind of holds right along. We're doing the same thing here with period prevalence. So we take the average, and we know how many people had the disease at the beginning, how many people had the disease at the end of that time span, and we divide it over the population. Okay? I hope that takes a few minutes to kind of redo that. I do want to take, and I'm going to go ahead now and start looking at the heart disease is a big problem in Jordan. Yes. I'm going to go ahead. I've got 26 questions, guys, and that's going to finish out class. So please don't post a new question. I'm going to take the time to answer the questions that are here. First question that I have now is it is actually surprising that the percentage of obesity in females is higher than males. What's the reason? Oh, this is very cultural. Your rate is higher because women here tend to have a more sedentary lifestyle. In other words, they don't go out and jog every day. They don't go out and exercise. Going to the gym is segregated. A lot of that is very much, I see one more person who is a female, and she is Western, that is out jogging in the morning when I go out to walk my dog. I see several men and lots of different men out exercising, but I don't see the women. It really does have to do with a cultural aspect of women being home. And I know that sounds horrible, but it is very much cultural why we see a higher rate of obesity in women here in Jordan specifically. So that was a great question, Safe. What is the main risk in the world? So main risk in the world, if we're talking about NCDs, cardiovascular disease. Okay. Because cardiovascular disease is impounded by several different things. Diabetes increases your risk of cardiovascular disease by about 30%. Poor diet, high fat, cholesterol increases your risk for cardiovascular disease. Being sedentary and not exercising increases your risk for cardiovascular disease. Notice again, we're going back into health behaviors. So when we go globally around the world, it is cardiovascular disease. That's a great question, Anonymous. I'll publish that one as well. Okay. Next statement or question. As obesity increases, the risk of cardiovascular accidents will increase, causing to make prior action to decrease the CVAs and obesity percentage, which is incredibly going to be taking time for increasing its awareness. I think you're talking about and saying just what I was saying. If I stand correct from that, yes, obesity also impacts on cardiovascular disease. Everything tends to impact on cardiovascular disease. So we definitely, and what's funny is your diet right now, you all are in your, 18, 20 years old. You're not thinking about when you eat a cheeseburger because it doesn't make you fat. You've got a good metabolism. You go out and you exercise and life is great. Okay. But what you are doing now is starting to build up cholesterol and bad cholesterol, what we call LDLs, low density lipids. Those low density lipids over time, it's 10 or 15, it's what you eat in your 20s and 30s that have a great impact on whether you have heart disease in your 40s and 50s. So it's hard, and it's hard. Think about this. It's hard to picture doing something that the benefit doesn't show up until literally decades later. Okay, that the sense of being able to defer gratification, or the sense of knowing how much it benefits you. It's like saving money in the bank. Would I rather have something right now, or do I want to save it and have more in the bank for later? Sometimes that impulse. Okay, doctor, all of us know that smoking is the main reason of NCDs, but in our community, people don't listen and don't care. Yeah, but here's the problem. From a policy standpoint, You are a young culture. So let's bring this back to policy. And very quickly, what I can tell you is you're a young culture, which means the heart disease and all the effects of smoking will affect you when you're 50, 60, 70 years old. When you all get to be an older population, there won't be enough money in the government to take care of you. So therefore, the government has to think about setting health policies that change that, because there's not an endless supply of money that just comes from nowhere and takes care of all the health issues in the budget the government has to work under. So we have that problem. Okay. It is also common in the female community. Actually, Miriam, you mentioned the comment, if you're talking about smoking, we can talk about smoking from the shisha perspective for women. Here culturally, it's not really okay to smoke cigarettes, but shisha is perfectly acceptable. So we definitely have some things. Yes, you all are right on track. Guys, like I said, I can't get through all the questions. I'm seeing more questions being added. We'll be here for another hour. So I can only go through, I'm only going through about the next 15 questions, okay? Because I know I'm at time. It is not recommended for smoking in front of children. Yes, they learn passive smoking. That's the secondhand smoke. You're absolutely correct. It's all related to, we don't have cameras to control the law. We break it. Oh, that's an interesting concept. We'll talk about that. Here's the thing. If we talk about behavior, I should not have to have an external reinforcement or external, and typically that is what we consider a punishment. We need it to become internal, where we talk about it becoming intrinsic. It needs to be something you value and you make important. That's when behavior change takes root, and that's when behavior change works long term. So we'll talk more about that as we go forward. Excellent comment. Yes, but we should not have to have cameras. Okay. Let me see. Doc, why don't we hear about mental health in the Middle East, unlike the US? That is very much, oh, sorry guys. That is very much a cultural component as well. Mental health is seen as a weakness, versus what we know is that mental health actually has lots of biological components. That is something that needs to be reckoned with and dealt with, and that's why the WHO is so involved with mental health issues and trying to make sure that mental health is starting to be addressed in the public health setting. And stuff. So that's an excellent question. And if you're here when I teach psychology in third year, you'll get to hear a whole lot. We'll talk a whole lot about that. Yes. Some of you all are telling me it was cause specific, which was excellent. Add trafficking policies on the road, highly important. Exactly. We can talk about wearing seat belts as a policy. I find it very interesting. You all have a law, but it's not really enforced. And most people here don't wear seatbelts. I can't ride in a car without a seatbelt. It feels like it feels strange, because we've required seatbelt laws since I was a teenager, okay, in the US. And I actually don't feel safe. Without a seatbelt, I don't feel safe driving the car. People laugh. I'm going around the parking lot and I'm like, oh, gotta put my seatbelt on and stuff. So we have things like that. You all have lots of great comments. I know we're really almost at the time where we need to end class. Several of you, yes, yay. How females got high obesity and less cardiovascular disease. Actually, that's a good question. Oh, anonymous, I like this question. This is the question I'm going to end on today, because this is an excellent question. They said, how come, and I just published it, okay, so if you're reading them, you will see this, how females get high obesity and less cardiovascular disease and have a longer life expectancy. There are two different things going on here. One is that women, up until they reach menopause, The hormones protect us from heart disease. So when we talk about this, they are protected up until the point of menopause. After menopause, the rate of heart disease goes up dramatically for women. So once they get into their 50s, usually, and that's most women at that point are postmenopausal, the heart disease rate goes up dramatically and it's no longer there. We do see that number shift, but before then, even though they're sedentary, what's happening is the estrogen is protecting them. Life expectancy, in general, women live longer with life expectancy because they take less risk. That's just across the board, from how they drive to bungee jumping to their diet. Typically, they're just lower risk takers, therefore they're less likely to die prematurely. Thus, they have a longer life expectancy. That's a great question to end class on. Like I said, I will take some time. I do encourage you all. A lot of you are popping in office hours and asking questions. That's the perfect time to ask questions because some of them take a lot of time. And some of you have the same questions, so I encourage that and keep using that. I will post and publish several questions for you to try, and I'm also going to post this survey on smoking, and specifically not only smoking but on vaping. I do want all of you, and I want to encourage all of you, please. I have almost 700 of you in this class now. I would like to see at least 650 of you take the survey. It will be really informative. As you take it, think about some of the questions I'm asking you. The other thing is I'm going to do something different. I actually had one of the faculty translate the survey into Arabic. So for those of you that think your English isn't as good, no excuses. It's in Arabic for you. I have the English version, so I know what they've asked, but one of the faculty translated it for me. So this is the one time you're going to get a survey in Arabic from me and stuff. And I hope you all have a lovely weekend. And I will post all those things to your website. Keep talking, keep thinking about things, and I'll see you for class next Monday. Have a good weekend.